Legalization of marijuana. One of the most debated topics in the modern United States of America is, should we legalize marijuana? Some people believe it should be limited to medical usage, while others feel it should be legalized fully. In California and Colorado it is now legal, but in other states it is prohibited. This substance hasn't been legalized because of myths and false truths about the side effects, including cancer, and being a gateway drug, when in some circumstances it is quite the opposite. Marijuana is often used in many medical instances, such as being used as a painkiller or stimulant for eating. It has also racked up the amount of people being put in prison for not only the use but simply the possession. If keeping this plant prohibited means throwing people in prison or preventing New Age medical techniques, then it brings forth the question of, why isn't it allowed? At the young age of 28, Daniel Peterson was diagnosed with a form of terminal cancer called cholangiocarcinoma, which is bile duct cancer. This particular form of cancer is a very rare disease in the bile duct and causes cancer of the liver. The cancer was inoperable, and he was given 3 to 6 months to live. But according to Daniel's father, Jerry Peterson, Danny was given numerous rounds of radiation and chemotherapy, which caused him to lose 60 pounds due to the extreme nausea and total loss of appetite. In a situation where your life is faltering, losing that much weight can make symptoms worse and more painful. Daniel was also given a large quantity of drugs, including Coumadin, Lovenox, Ambien, Lasix, along with fentanyl patch, oxycodone, and morphine, as well as lorazepam, trazodone, and Celexa for his anxiety and depression. According to Jerry, many of these drugs caused Daniel to have hallucinations and behave erratically, which had frustrated him and the family, as it wasn't the normal way for him to act. Along with all these, he was given antibiotics and learned that he was allergic to many medicines, making him options even slimmer. As an active man, Daniel wanted to keep his landscaping business going, so he used marijuana to keep his appetite up and null the pain. Apparently it worked, and even his father said the use of medical marijuana by our son allowed him much greater quality of life, with reduced pain and suffering. After witnessing the near miraculous benefits it provided to our son, my wife and I agreed that we would go to jail or prison if need to be, to support him in this particular use of what is presently an illegal drug. Obviously, this so-called drug has medical possibilities that no one had witnessed before now, that are beneficial for terminal illness sufferers. The medical uses aren't limited to cancer, but actually go much further. According to healthyplace.com, marijuana can actually help with eczema, epilepsy, Huntington's disease, and insomnia. Also on heat.com, it says marijuana helps in many ways, from reducing glaucoma and helping people going through chemo, to treating depression and battling skin conditions. Even on Harvard's medical site, www.healthharvard.edu, it says that marijuana is beneficial for AIDS patients and multiple sclerosis patients. It is evident, and its limits go far beyond recreational use and defeat its stereotypes, proving viable as a treatment in the medical world. While marijuana does affect the mind and the nervous system, its main critique is its effect on the lungs. The most common way to use cannabis is by smoking it from either a pipe, joint, bong, or inhaled ways. This act burns and destroys the cilia in your lungs, causing for pathogens and other foreign bodies to enter the lungs. Since this is the main way to receive a high or any relief, it is looked down upon and affects the homeostasis, the tendency toward a relatively stable equilibrium between interdependent elements, especially as maintained by psychological processes of the body. To combat this side effect, other ways of receiving the chemicals in the plant, one of the other main ways is ingestion. Cannabis is also turned into what's called cannabis butter, which is purified form of it, which can be used in any cooking. If it isn't turned into the cannabis butter, it has no effect on the human body. With other ways to prevent some of the negative side effects, it is easy to say that marijuana is equivalent to many other modern medicine.
Who you are and your profession.
Sure, I'm Carrie Blossendane, and I'm a pharmacist, and I own Pharmacy of the Woods.
Okay. So our first question is, what is like the main effect of using marijuana? Like what's the main use for it medically? the main, like,
The main use for it medically.
yes.
Well, in hospitals, it's used for nausea in cancer patients.
Okay. Would you mind telling your personal opinion on medical marijuana?
Not at all. Cannabis, period, medically or not, precipitates in the nerve synapses. So you have a nerve with a nerve ending, and you have another nerve with a nerve ending. And the way that a nerve impulse jumps the nerve synapse or gap from one nerve to the other is by two ways. It's electrical, and then there are neurotransmitters, which are chemicals, which allow the nerve impulse to jump the gap. The problem with cannabis is it precipitates in those nerve synapses. So people that habitually use cannabis get an accumulation in the nerve synapses. Over time, it does decrease the speed that the impulse travels through the gap. So that's why people tend to become more laid back, and over time they're just not as sharp and their memories are not as good. So I am so against the legalization of marijuana. I think it was a huge mistake. I think it's the reason why it's being passed has nothing to do with benefits. It's all about finance and greed and money on the state level. And I think that long term, we're just throwing another bad drug into the mix. And most of the controlled substances that I dispense here, the people are just worse off for having it. And it'll just be another one. That's my opinion.
All right. Austin, do you have any questions?
No, that's good. Thank you.
All right. Thank you so much.
All right. State your name and profession.
My name's David. I'm retired law enforcement. Worked LA County Sheriff's and City of El Monte Police.
All right, David. What are your thoughts about legalizing marijuana for medical purposes?
Now, I've been flying helicopters for about 25 years, and obviously aviation has a tight span as far as using illicit drugs, so I don't really have too much of an opinion. I don't use it, but if somebody else wants to, that's their own business.
What are you going to do for legalizing marijuana if people are willing to follow all of the rules 100% legally, federally, and
the marijuana thing is such a big thing. I think medical should happen, right? Don't we agree? I mean, I think so. And then I really believe you should leave it up to the states. It should be a state situation. Because, you have, like I just left Colorado, and I love Colorado, and the people are great. But there's a question as to how it's all working out there. That's not going exactly trouble-free. So I really think that we should study Colorado, see what's happening. But I believe that the legalization of marijuana, other than for medical, because I think medical, I know people that are very, very sick, and for whatever reason, the marijuana really helps them. But it really helps them. But I think in terms of marijuana, and legalization, I think that should be a state issue, state by state. Good question. Go ahead, over here.